Morning, sisters and brothers. I'm Libby Devlin. I'm the Southern Region Director for National Nurses United. NNU is committed to building working-class organization among nurses who can exert power in order to improve working conditions for all nurses and to improve patient care in this country. Using this big organizing model that Joe just talked about, we created a campaign that would build cadre among nurses, among non-union nurses, to become leaders and activists in Florida and Texas, committed to Medicare for all and RN to patient ratios. The idea was we would identify a committed core of leaders who would work with a militant minority of nurses and then would lead these non-union nurses in the campaign for Medicare for all. I'm happy to say that we were able to do that. We communicated with 200,000 non-union nurses in Florida and Texas about Medicare for all and about the electoral campaigns of Andrew Gillum and Beto O'Rourke. Thousands said they wanted to get involved in the campaign, and a smaller number, but still thousands, said they wanted to play a leadership role in the campaign to win Medicare for all. I'm going to get into a little bit of more detail as we go along, but the key point here is that using this big organizing model, we put together a campaign that got to scale very, very quickly. And the leaders of that campaign are now positioned to join the existing membership of NNU in the campaign to win this extremely important public policy issue, while they'll also be building a working-class organization in their hospitals. In order to do this, in order to build the committed core and the cadre, we had to have certain things in place. The first thing is we needed to have a calling card issue. For NNU, the calling card issue is Medicare for all and RN to patient ratios. Not a surprise. This combines an important workplace issue and an important public policy issue that are both very important to nurses. Nurses, as we know, are on the front lines of the healthcare crisis in this country. The work of the registered nurses is core to who they are. Their ability to advocate for their patients is critical to their sense of who they are and what they do. And when they cannot provide the care that they need to, their calling is undermined. They're also very aware that when patient care is denied, what that does is provide additional profits for their employers, as well as for the healthcare industry in general. Every day, the nurses see the damage that is done based on the lack of healthcare. They better than anyone know that what we need in this country is a public policy that provides for a single standard of care that is safe, effective, and therapeutic, and not based on the ability to pay. So as a result, Medicare for all is a calling card issue for NNU and for the nurses. Every industry and organization is going to have their own calling card issue. There is no shortage of struggles in this country right now that people can engage in related to climate justice, immigration, public education, racial justice, ending voter suppression. You get the idea. The point here is that when democracy is under attack the way it is today, the sky is unfortunately the limit. So the first thing that you need is this calling card issue. The second thing you need is a sense of urgency. For us in Florida and Texas, it was the electoral campaigns of Beto O'Rourke for senator and Andrew Gillum for governor that created that sense of urgency. Their campaigns, they were both committed to Medicare for all. There was a tremendous amount of excitement in both states around those campaigns, and it was a way for timing to be right to do this very broad outreach and to create these campaigns that got people very excited. The third thing you need is the proper technology to do this broad outreach. And that's where the big organizing model comes in. We used peer-to-peer texting. It's this technology, it's called Relay. It gave us the ability to get to scale very quickly. In order to reach 200,000 non-union RNs, I keep saying that number because it's shocking to me, we accessed publicly available RN lists. We compared it to the voter file. We created these contact lists. We then had these texting communication with this Relay program. We were able to identify close to 17,000 nurses who wanted to be involved and 3,000 who wanted to be leaders in the campaign. So this is what we consider sort of the committed core and the militant minority. And they're all in non-union workplaces, non-union hospitals. I will admit I was initially skeptical about this so-called big organizing model. Using technology to reach out to workers, I've been an organizer all my life. I'm like, But I have to say, the problems that we face in this country are daunting. The problems we face as a labor movement are also daunting, and we need to be open to methods that we have not used before. So we tried it out. Prior to the Janus Supreme Court decision, which we all know brought the right to work to the public sector, we were already at an all-time low of 10.7% union density. In the private sector, only 7% of people have collective bargaining. What's worse is that only fewer than 1% of those eligible to participate in elections that would force employers to recognize the union and bargain with the workers, fewer than 1% participate in elections each year in this country. So if we take it as a given that the power of the working class is rooted in our ability to engage in collective action, it is also true that without unions, our ability to exercise power is seriously constrained. So unions need to have a plan for how we are going to engage the 93% of private sector workers who don't currently have collective bargaining. At a minimum, we need to have venues for workers to engage in collective action and shape the outcomes of the important debates in this country. We all know that both U.S. political parties carry out different aspects of neoliberal and libertarian ideologies of increased privatization, austerity, reduced regulation, and free trade. Both political parties seek to concentrate power into the hands of an increasingly smaller number of multinational corporations and libertarian institutions. These ideologies that focus on individual advantage and reward selfishness make no room for collective well-being. And they result in the destruction of any common good that cannot be monetized. We say that the working class must oppose these ideologies, and in order to do that, we have to build organization and get to scale very quickly. That's the theory behind big organizing. In the organizing world, nothing will ever replace one-to-one personal communication and relationships. However, this one-on-one style of organizing may not be sufficient for the challenges that we face. The technology of big organizing model addresses that challenge and allows us to get to scale in reaching out to workers around an issue that they care about, and then identifying those who we can move into action and ultimately into working class organization that can shape public policy and can address workplace issues. So once we identified the interested nurses using this relay technology, we set up 16 county-based meetings with the committed core to discuss what a longer-term movement for Medicare for All might look like in Florida and Texas. In Florida, we held 11 meetings. In Texas, we held 5. Those nurses in those meetings discussed a local plan, and then they reached out to this militant minority that we had identified to engage them further in the campaign. We held trainings specific to the campaign, and we've scheduled additional trainings on how to communicate and organize around Medicare for All. Each county will be part of the overall campaign, participating in the national strategy. But they will also create their own local plan for their region. The idea is that everyone agrees to a common set of principles, and then they get trained to be a leader in the campaign. But locally, people do creative actions so that nurses can build their own local organization. These local actions can really be almost anything, including meetings with local electeds, attending public hearings, town halls, barnstorms, passing city and county resolutions in support of Medicare for All, holding demonstrations, leafleting public areas, farmers markets, libraries, essentially anything that helps them to build organization locally. But here's the kicker. Ultimately, In order to truly exert power, more nurses and workers will need to engage in collective bargaining. And that's a discussion for another day.